U.S. Senator Maria Cantwell visited Shelton to host a roundtable with Mason County first responders, law enforcement, and public health officials about the opioid epidemic. The Seattle Democrat led the discussion at Mason General Hospital on Saturday. Cantwell and California Democratic Senator Kamala Harris recently introduced legislation called the Comprehensive Addiction Reform, Education, and Safety Act. It would hold drug manufacturers accountable for aggressive and misleading advertising and negligent distribution practices that help instigate the ongoing drug crisis.
Very important that the manufacturers do follow the law and do report. Unfortunately, they're not doing that. And one of the reasons why they're not doing that is because the penalty for not reporting is so minimal. It's in the tens of thousands of dollars. We want to change that to the millions of dollars so that we can get their attention. Second, we want to give law enforcement the tools they need to fight the heroin epidemic, because add-on to this crisis is the fact that as people have not gotten access or who have been addicted and want to find a cheaper option, they have gone to the community and found heroin.
Cantwell's proposal would double the maximum criminal penalty to $500,000 for companies who violate the act. The law would also target doctors who overprescribe opioids. Jeremiah Welder, a reformed drug addict in Mason County, told Cantwell he gamed the system to get a steady flow of prescription pain medication.
I started out as a prescription pain pill addict, and then I did have that progression to heroin, which I think a lot of people do. I was a pretty good manipulator of doctors. I actually did turn an ankle sprain into about a 6-month prescription of Vicodin. And that's where I think that you have manipulation on so many levels. A lot of these doctors don't know what they're up against dealing with drug addicts that are so good at manipulating people.
Welder urged law enforcement authorities to find out what doctors are prescribing pain medication in larger quantities. John Short with Mason General Hospital's Emergency Medicine Department talked about the origin of the opioid drug crisis from a doctor's perspective.
This all started with a study done about 15 years ago that suggested that we were undertreating pain in the United States. I thought I was treating pain perfectly adequately. And then all of a sudden, what it becomes is, well, okay, people with bones sticking out and stuff like that, that's pretty obvious, but I guess I have to treat these other folks who are having painful conditions that I began giving things like hydrocodone to people with ankle sprains. If any of you've had an ankle sprain, yeah, it hurts for a day or two, you probably don't need Vicodin for that. And then you get sort of, then the pain is the fifth vital sign. And so you sort of gotten browbeat into providing opiates. And
Psychiatric Dr. Sarah Magnussen White shared her biggest concern.
What I'm worried about now is going from, and I have found in my profession, everything goes from one extreme to the other. And we tend to have problems when it's either here or there. What I'm worried about is with the restrictions that are starting to happen, without there being any algorithms or without there being any clear identifiers of, for example, what is acute pain.
Senator Cantwell says she was wrapping up her fact-finding mission across the state from Spokane to Port Angeles and Longview. Then it's back to her office in Washington, D.C. I'm Jeff Chu for I-501 News.